welcome back. This is day 2 of the CCIH virtual conference. This whole week, the focus has been on leadership. And as I mentioned, with this conference being virtual, I'm missing out on the conversations I would normally be having. So each day, I'm responding to the panel and some of the topics that came up during that discussion and sharing a few of my highlights with you, as well as trying to engage in broader conversations around the topics that are discussed. While an hour might seem like it would be plenty of time, we find that it goes by really quickly, and often there isn't enough time to have the discussions that would normally happen in the hallways, between the meetings, the side conversations, the times when we really get a chance to say, okay, now that we've talked about this topic, what do we do with it? How do we apply it to the context we're in? And what about all these other variables that weren't included in the discussion? So that's the intent with these. I'm trying to keep them brief, and hopefully even for the sessions you're not able to attend, you can join this conversation with some of the highlights that I'm sharing here. So today, this is for the day 2 session. The subject was gender-based violence, and this might not be a subject that people always immediately associate with healthcare, but the reality is that healthcare providers around the world are often the ones that are the first to know about the abuse that's going on, and also the ones that are helping those that have suffered violence walk through the healing process, not only physically, but emotionally and psychologically and financially and all these different ways that are going to get addressed in this session. So today's session featured, again, 3 panelists, and I will put all their contact information in the description below so you can follow up and learn more about what they do and what their contributions are. I'm going to very briefly touch on a few topics. So the first is, I have one of these slides up here. I was completely shocked to find that 1 in 2 women that are killed worldwide, it is at the hands of a partner or family member. That's shocking. I don't even know, with all of the discussions that we talk about this, I knew gender-based violence was a problem, but 1 in 2, 50%, this is a big issue. And this is an issue that we need to stand together and respond to. So we're going to talk a little bit about some of what was covered in today's session. One of the things I want to talk about first and foremost is it can often feel like in low resource environments that we already don't have enough supplies and equipment and staff and time and everything else for the needs that are right in front of us, for the needs that only a doctor can respond to, for the needs that only a nurse knows how to handle. And how can we possibly take on all these other issues? And so I want to start with the first example here is from Dr. John in South Sudan. And South Sudan is one of the world's poorest countries. There is so much that needs to get done. And yet in this space, they have actually been able to provide a holistic response. And that's what this conference focus is all about, is providing a holistic response to the needs of those around us. And so I want to let you briefly hear from him, some of what he shared with us. And then we'll talk about a few of the other items that were discussed around what are some next steps, what can we do, how can we help address this issue. But first, I just want to share his one-stop center, and this again is for a holistic approach.
So IMA World Health came up with the one-stop center for comprehensive and holistic sexual and gender-based violence case management in B.Cur, it's the Jungle Estate in South Sudan. The picture there is for the team, the great team that works there under the leadership of our very able Chandia Teddy, the lady on the right, and she leads a very comprehensive team of medical doctors, clinical officers, nurses. There's a lawyer on the team, there are social workers as well, and case managers as well. And this whole team works around to make sure that we provide immediate clinical services, including case management, clinical management of REP, where that's happened, mental health and psychosocial support. We also support survivors with the legal support, scholastic material for girls who've been pulled out of school to be forced into marriage, for example, emergency cash assistance for survivors who want to get to safety and they don't have any resources to do that. But the team also does not provide everything internally. They map out and link survivors to other service providers outside. It could be non-food items, protection, and police. But also once the survivors are good to go back to the community referrals happen to faith leaders in the communities or to women-friendly spaces.
So as we heard there, this holistic response involves not only providing a variety of services, but it also involves engaging with the community. And one of the things that came up quite a bit in this session was the fact that not only do we have situations where the church is not necessarily the first idea of where to go in these situations, but actually there are people who are concerned about the church's response to fleeing abuse, to getting out of situations that are dangerous, to how would the church respond if I say, the forced marriage that I am in is dangerous for me physically. And so there's a number of questions and complexities that need to be thought through. And that's actually something that the second speaker, who represents not only the Adventist side from the women's ministry, but also from the development ADRA side. And so she really talked about the role that churches can play in having public statements, in being able to speak to the theology of these sorts of questions, and to really make sure that the church can be a safe space. So I want to have a chance to share with you some of the resources that she shared, and this is here from Katia. You can see this list. CCIH obviously is who's putting on this conference, and they have an entire section of resources around that. And then also Futures Without Violence, Faith Trust Institute, and Safety Apps for Survivors were some of the resources that she shared with us, along with a number of strategies around how to engage faith communities, government, civil society, as well as the health sector.
The other sites and resources. We pray that we take this as our ethical and moral responsibility, as it says in Proverbs 31:8, that we should speak up for those that cannot speak for themselves. Thank you.
And then the third one that I want to share with you, this was one of the other speakers, and this was who shared the slide you saw at the beginning around how bad the situation is, right? So that slide right at the beginning when we talked about this being 1 and 2, this is where that resource came from. So if you would like additional information, you see her email, her website right here. You can check that out, and I just want to quickly let her share a little bit of what can we do, what are some of the solutions that we have available.
Very critical time. I believe faith leaders and faith communities have a very specific role to play. I have identified 5 areas, and interesting, both John and Katia have referred already to many of these points. And I'm sure if we think about it, we could add very many more, but I have only 10 minutes.
So when we look at the questions around gender-based violence, it really brings up a bigger question, which is, what is our role? What is our role as healthcare providers? What is our role as business leaders, as nonprofits? What is our role as individuals, as humans? What is our role when it comes to the things that we encounter, the injustice that we encounter, the violence that we encounter, the danger that we encounter? And I think one of the things that was really a key reason to bring this up in this first week, in this context around leadership, was really to say this is not just an issue for those who are trained in this crisis response. This is not just an issue for those who are dealing with this personally, but this is something that as leaders, we must stand up and say, this is not okay. We are going to address this. We're going to respond to this. We're going to provide the resources and safe places. And we're going to take a stand against gender-based violence. So I appreciate that was the intent with CCIH, and that this was included in leadership panel, and look forward to hearing tomorrow. The topic is on disabilities and inclusion and what that looks like in low resource environments. So see you then.